Hey guys, it's Mimi1239 here, and I'm here to give you guys my surgery story. Now, this video is going to be kind of serious and sad, but it does have a good ending, so we gotta look at the positive side. And I am kind of nervous to be filming this just because it has been a very difficult experience for me, and this happened really recently, but I still wanted to talk about it. I still wanted to explain what happened, and yeah, so let's just get into it. So I've done videos in the past where I've talked about my struggles with polycystic ovarian syndrome, also known as PCOS. I'll leave a card somewhere here where you guys can check those videos out. I'm going to give a little recap of how this story begins and how I knew I was going to have surgery. So in early 2018, I went to my doctor, my family doctor, and I was talking to her about my acne because I did have a big issue with acne, like on my chest and on my back. And she referred to me to a dermatologist, where the dermatologist said that my problem with the acne actually had to do with PCOS. And that was the first time I was told that I had PCOS. I kind of suspected it in the past just because of the other symptoms I was having. And then she referred to me to an endocrinologist where I did some tests. I did an ultrasound where they found out that I have an enlarged cyst. This was in February of 2019. I just remember going there and it was this older man doing the ultrasound, and it was my first ever pelvic ultrasound. It felt really painful when he would put pressure on my pelvic, and he was like, "Oh, do you have regular periods?" And I said no. And he said, "Oh, okay." And he wasn't able to tell me why that was. But then I went back to my endocrinologist after the results came back, and she said I had a 9-centimeter cyst on my ovary. That was the first time I ever heard about it. But after I went to that appointment, I walked home with my mom. I did notice I felt uncomfortable when I would walk for a long period of time. It would hurt in that region. And then the endocrinologist referred me to a gynecologist during the summer of 2019. That was when I found out that I needed to have surgery for the cyst that I had. This was after I came back from Ecuador, and I was feeling already very sad, but hearing this news was scary, obviously. We were trying to find a way to preserve the ovary so that they could remove the cyst and maintain my ovary so I could have my both ovaries, right? And my gynecologist said that she would try her best, but unfortunately, we didn't have the best experience with my gynecologist because mainly had to do with her secretary, but also we didn't feel very comfortable with her. She was assuring. I felt more passive when we would go to her appointments. It took forever to just get an appointment with her because of her secretary. She wouldn't answer any calls. She wouldn't answer any voicemails, nothing. Literally nothing. So in October of 2019, I went to do more tests, and they saw that my cyst had grown to 11 centimeters. I said, okay, I'm going to do the surgery in May. And obviously comes May and we have the C word. We're in the pandemic, and my gynecologist says, okay, we're gonna have to postpone this because we can't have you doing a surgery during the pandemic. And I was like, okay. During this time of the summer, just so that I wouldn't have to go through the surgery, we were trying to find different treatments for my cyst. Unfortunately, a cyst this big cannot be treated like this, normally, with teas or herbals or anything like that. So even though I did take teas and medicine, it just didn't help. It kept getting bigger without me knowing it. And then during September of this year, I went back to see my gynecologist. We realized then that we just didn't feel comfortable enough with her doing the surgery. We wanted an alternative opinion. So we decided to go to another doctor, and then he referred to us to another gynecologist, and this gynecologist acted more urgently. She saw that my cyst at this point, which I went to go do an ultrasound at the beginning of October, and my cyst had grown, I believe it was 15 at this point. And so the whole time I was thinking the other treatments that I was taking would help, weren't helping, and my cyst was growing bigger. And when this gynecologist saw the size of my cyst, she immediately was very concerned. She said that she would refer me to an oncologist. Basically, that meant a cancer doctor would treat me in case my cyst ended up being cancerous, which was very, very unlikely because of my age and because of the fact that my cyst wasn't hurting or anything like that. It didn't seem like that type of cyst, but it was still a very urgent matter because it gotten so big and obviously could rupture or could damage my ovary, and that could be painful. As I said, this was in October, so October, which was like 2 months ago, right? And so I remember hearing the word cancer, and I remember I had to do a blood test right after I saw this gynecologist, and while I was in line, I was very anxious, and this was the first time that I just started crying over this whole situation, knowing I had to have surgery, but then also being highly stressed out over school and over this whole matter without knowing how I would do everything, how I would manage. And so I remember just starting to cry in the line, and I bet people probably just thought I was nervous about the needle or whatever, which I wasn't. I just couldn't handle it. I remember crying. I'm gonna cry again. It was just a very scary, scary time. And oh my God. My parents were there. Obviously, they were comforting me. A week before my birthday, which was October 28th, I had to do an MRI scan just to, check and make sure that they had all the right measurements and just to see the cyst clearly. And I went to that. I had to enter the hospital by myself because, the restrictions and everything. So I put on a gown, and I went into that, tube thing. So then a week later, my gynecologist received the results, and she told me on my birthday, which I was already crying a lot during my birthday, before this whole thing. This was in the morning. I had to go see my orthodontist with my family. Literally everyone in my family had to go for an appointment in the morning while my dad and I were waiting for our time to be called in. My oncologist called, and she said my cyst was, it was almost 16 centimeters. And I also had this other thing called a dermoid cyst, which was 2 centimeters. If you can imagine the size of an orange when my cyst was at 9 centimeters, for it to be almost double that at this point was very, very scary for me. The dermoid was just another entity, I guess you could say. And she sounded very assuring, and she actually made me feel comfortable, which is why I decided to go with her. She said I could book you in for next week on Friday, which was November 13th. During that time, I had my reading week for school, which is a whole week off from university. And so I had to decide right then if I would have the surgery a week from the time that I was talking to my oncologist. And I said yes, without much hesitation, because I knew that this could be serious. I didn't want to have to wait another month and a half with the risk of everything shutting down again because of the pandemic. So with my previous gynecologist, we had discussed December 16th as being the day that I would have the surgery with her. But as I said, I wasn't feeling very confident in that. So when my oncologist said we could have the surgery November 13, and I could give you a medical note for any missed classes or any assignments, I was feeling confident in that, and I said, okay, I'll do it. I kept crying that day, out of fear and out of just, I don't know, I just felt very anxious, and obviously it wasn't any better for my mom. She was very, very concerned, very worried. I just had a whole week to finish as much homework as I could, but also to stress out about this whole situation. Perhaps it doesn't seem as big of a deal as it was to me, but it was just very scary. I forgot to explain the most important thing about this call that I had with my oncologist, and it was that she wouldn't be able to preserve. She said we would have to do a surgery called salpingo-oophorectomy, which is the removal of my cyst, my fallopian tube, and my ovary, and obviously the dermoid cyst. So that would mean taking out everything from the left side, which I forgot to say that it's on my left side. She said there's no other way because we want to make sure that it isn't cancer. But she said it was very unlikely that it would be cancer. I was still very nervous about it. And I remember just after that call, my dad went back in to see my orthodontist, and I just went outside and I just started crying again by myself in the middle of the street on my birthday. It was not fun. I was so emotional those days coming up to the surgery. Even on my birthday, I just remember my parents and my sister putting up balloons for me, and I don't think I've ever had balloons on my birthday, and I just remember walking into the room and just started crying because I didn't know what would happen. Even before knowing about the whole surgery situation, I was just very emotional. Anyway, then they said I also had to do a COVID test a few days before I went in for the surgery. So I was also nervous about that, but I was like, you know what? A lot of people have done it. I'll be okay. And I go in, they stick the swab up my nose and it stung afterward, but I was okay. I was like, this is the least of my worries. And obviously I got a negative result. I went on the Friday, which is, as I said, November 13. I went for the surgery and oh my God, I had to wait. Oh my God. I got there at like 9 and I had been sitting there almost the entire day. I had to wear like this robe. I will show like a picture here. I had my mask on. My parents were there. The gown, it's called a gown. I had like a robe covering me from like the back part. They give you like booties and I had to wear them. It was so cold because I had my socks on and that was it. The floor was freezing. They also give us like blankets and stuff. There was a lot of people there having surgery that day and my mom and I were like very impressed, I guess, because of how many people have to have surgery every day. We're obviously never in this type of situation. So I wait there till 4 and I'm like they told me I couldn't eat anything from midnight the day before. So I spent the entire day waiting for my surgery with nothing to eat. I couldn't drink anything, any liquids, water preferably, past, I think it was 8 in the morning. So I only had like small bits of water throughout the day because of my mouth, because obviously with the mask on, your mouth can get very dry. So then I get called in. I remember telling my mom that obviously because of the whole like COVID restrictions and social distancing, I didn't want to hug her, I guess, inside the hospital because we're supposed to be social distancing. And so I remember telling her the day before, I said, if I don't hug you, it's because of that. And I don't want to be crying when I go into the surgery room. So it was going to be very difficult for me to say bye to her. And I told her she could be the one to come in with me to talk to the doctor before I went into the surgery room. And we were just waiting there. And the anesthesiologist came in to talk to me and he said, we almost canceled your appointment. And I was like shook. I was literally shook. Not that it was like a bad thing, but that kind of made me more stressed. I talked to the doctor and for some reason, I just started crying right before she came in. She came in and she saw me crying. She was very comforting and my mom knows mostly Spanish. So the doctor was like trying to communicate with her, but she was, you know, she did understand some Spanish. So that was okay. And she explained the whole procedure to me again. Right before I went in, I remember my mom and I just like making jokes because that always helps us to calm down. And then finally they call me in and I'm like the second last person to be called in for surgery that day. There was a lot of people going in for surgery and I was the second last person. Before I actually enter the room, you know, I'm with my mom and she's telling me stuff. She's like, I love you. And I don't know. I don't remember what she's saying, but she's just trying to be comforting to me and supportive and encouraging. And I remember just holding her hand like this, not looking her in the eye because I just couldn't say goodbye. It was very, 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 very difficult to look at her because I knew I would have started crying. I said I love you and then I just left. I couldn't say bye. I think I said I love you. If I didn't, it was because I was gonna cry. Literally. I remember telling her after that. I remember saying, if I didn't say that, it's because I couldn't. Okay, now I'm crying. Wow. I go into the room and it's like this white room and it's nothing like I thought it would be. I've had surgery before. I had surgery when I was 4 years old, but I also remember it was a white room. I just didn't think it was going to be like that again. It doesn't make any sense what I'm saying, but I'm lying on the chair and I get introduced to everyone and I'm like, hi. Trying to be, you know, calm and everything. They start putting the IV in. They put it in this hand. It didn't work. My veins were so small because of how dehydrated I was. So they were trying to find it. They couldn't. And there's still a mark here. They ended up putting it in this hand. I was very nervous about the IV, actually. That was probably the thing I was most nervous about. Because I was like, you know what? Once I'm out, once they knock me out, I'm not going to feel a thing. So it's going to be fine. Afterward, of course, I will feel a thing. But before that, that's all I'm nervous about. Because when I was a kid and when I had surgery on my nose, the IV hurt a lot. So, you know, they put in the IV. It didn't really hurt. They just said, you're going to start feeling weird. I was like, okay. I started feeling very weird very quickly. I just remember, you know, like how in the movies, it's just everything is distorted. I remember I could see, because I'm lying like this, I could see double of this thing on the ceiling. My eyes just start shutting down, like forcefully. It was so intense. It was a very intense experience. And then I woke up. It literally felt like I went to sleep. I woke up and I'm in pain. And I'm in the recovery room, which is recovery room 1, because you get to be put into 2 recovery rooms. Recovery room 1 is where you are put in order to wait for the anesthesia to wear off. And so I was there when I woke up and I can just see this clock. And because I didn't have my glasses on for the entire day, especially after surgery. I didn't know what time it was. I couldn't see what time it was. So a nurse came up and I asked her what time it is, and she said it's 7:40. I went into surgery at 4:30-ish. And I got out there like 3 hours later. I just started crying because of how relieved I felt that this whole thing was over, that I didn't have a cyst anymore. I didn't have an ovary anymore, which I was sad about that, but the cyst was gone. My problem was gone, but obviously also because it hurt. Everything just below here, they had to cut. I'm going to stand up, I guess, for this. I don't know if I'm going to show this part. They had to cut here. And then obviously down here, which I'm not gonna, show that part, but they had to cut there. And then inside my belly button. So it hurt. I just remember there was a nurse. She's like, why are you crying? She's like, it's over. You're good. Like, the surgery was good. Why are you crying? And I just start crying more. Obviously, because you don't ask someone, why are you crying after having surgery? Okay. It was just very annoying and very insensitive. And then I think it was another nurse or the same nurse who was trying to uncover my blanket or something, and everything, my stomach and pelvic area was very, very sensitive. It hurts so much. I wanted to tell her, be careful, please, because I am very, very sensitive right now. And I just ended up saying it hurts. And she was like, well, you're gonna have to walk it off. She goes to another nurse and she tells her, we already gave her a lot of narcotics. And I'm like, that's not what I meant, but okay, thanks. I understand that they're there for hours and hours, but at least just try to be a little bit more patient, especially when you see that the patient is crying. I honestly understand why they don't understand why I'm crying. I'm not just crying because it's painful. I'm crying because of the relief that I felt that it was all over. But anyway, they rolled me out. They were working their butts off. They were trying to get me out of there as soon as possible. They rolled me out into recovery room 2, which is where I was able to see my mom again. And she came out and she helped me. There was a nurse there who, when she saw me, she saw I was crying, and she was very nice. She was very nice, and I'll always remember her because of that, because I remember she saw me and she was like, it's okay to cry. It's okay. She helped me out a lot. She helped me get up with my mom. Obviously, my mom was there helping, but she was just the nicest person ever. She was very understanding. She didn't even know exactly why I was crying, but it was just a relief, I guess. And it's also normal to cry after surgery, apparently. There's very different reactions. My sister, when she came out of surgery, she felt very cold. I was just the person that cries because that's who I am. I had to go to the bathroom. I don't even know how I did it. I was so dizzy. So nauseated. I put on my clothes. I was just like a pair of PJs. My mom rolled me out in the wheelchair and we went home. When I tell you I was so dizzy, I was a mess. I went into my bed. My sister fed me soup and then I went to sleep. And I do have some, clips of me during the first few days after my surgery, so I'll insert them right now. Feeling a lot better, not as hungry. I am constipated because I'm not allowed to do that much work, strength, TMI, but I'm feeling a lot better. And hopefully I'll be back up for school on Monday. It's Saturday now. I mean, it's Sunday now. And I'm watching Freaky with my sister. It's really fun. It's a good movie, and yeah. I probably look absolutely horrendous. Yesterday was kind of, I don't know how to explain it. It wasn't very good. A lot of problems, but today I feel a lot better, a lot more energized and stuff, so yeah. I'm also very stressed because of school. I am hungry right now, so I'm just waiting for my mom to prepare something for me. I can get up better. I have to shower, but other than that, I definitely have a lot less pain now, so that's good. And the phlegm and everything that I had before from the anesthesia is pretty much gone, so that's my update for today. Thanks. My charger fully can't pick it up. Great. Hi, we're on day 5 and it's hard. I'm feeling a lot better, but the issue is my classes, one of them is not functioning properly. I can't access the videos for tutorials, not for tutorials, for lectures and the screening, because I'm taking cinema courses, so. And then when I try to watch or
view the other courses. I get very tired very easily, so it's like, it's so hard. I have to keep taking time for myself and trying to recover as quick as possible so that I can get back to work. And yeah, because I have a lot of stuff to do for school. I have classes in like 20 minutes, yeah. And I'm just lying down so that I can rest before my class, because I tend to get really fatigued. My back starts to really hurt if I sit for too long, because I can't really sit up straight. So that's really hard, but I am getting a lot better at doing that, but it just, I have to sit for like 2 hours, 1 hour at a time, but still, it's still a lot, so. But yeah, wish me luck on that. That's the end of my update for today. So I think I just had some sort of attack or something, I don't know. But I felt dizzy, shortness of breath, and I started panicking, I guess. I started crying. After I finished taking a shower, I started feeling like that. And so I had to like go downstairs as fast as possible, as fast as my body could take me, and then lie down. And yeah, it's day 8. I didn't film a video yesterday because I didn't really, it was a pretty good day. We watched some movies, and for hours actually. So it was nice, but today was a bit more difficult, plus I haven't eaten anything all day. So I think that's probably why I was feeling like that. But yeah, we'll have better days.
I hope you guys enjoyed that. But yeah, that was how it felt. Like after, I don't remember when the last video I showed was. I think it was probably like day 9 or something, day 8. But after that, I did start feeling a lot better. I started taking out the, the tapes from my wounds. They've been healing ever since. I did have to get a medical note for my assignments that I had due. There's only one class that I needed the medical note, and that was a class that I was doing the best in, ironically. The other ones didn't, thankfully, because apparently my school doesn't actually need medical notes right now. I don't know. But anyway, I was able to walk by the second day, but it was obviously a very big challenge for me still. I really did have to start getting up and moving around very slowly, like a turtle. In the videos you guys just saw me, you can tell that my voice was very low and very like whispery, and that was because I had a lot of phlegm because of like some sort of gas that built up in your body from the anesthesia. But I was able to manage it because my mom was there with me 24/7. Like she would sleep when I would sleep. She was there for me 100%. She's the reason why I was able to recover so quickly and with no issues. Like she helped me out so much. My sister as well, my dad as well. But my mom was especially there for me during this time, this very, very difficult time. And she was very happy and very grateful that I was able to get out of everything okay. Now to talk about what happened afterward, what my doctor said about the surgery. There was no cancer, thank God. The cyst was, I think, like liquid, the big cyst. The dermoid was some sort of fat or something like that, but it wasn't anything malignant. It was all benign, thankfully. Maybe 2 weeks ago, I had like a post-operative checkup and she said I was fine. And then that was it. It's over now. Everything kind of happened for a reason. I did have a difficult time after the surgery feeling, I don't know how to explain it, but because I only have one ovary now, and that's the one that functions. If I had the other ovary removed, I would be in this thing called surgical menopause. I'm only 22. So to have one ovary already gone, I felt the sense of grief. I don't really know how to explain it, but I did have some days where I was just crying over that after the surgery. It felt like a loss, but in a sense, I also felt like I gained something from it because I was okay again. I'm so grateful for everything that happened in a way. Like I felt like it made me stronger. It was a difficult way to start off my 22 birthday or year with this whole surgery situation, but I'm also very grateful for everyone who sent me wishes, well wishes while I was going through this, like especially to Haifa. I'm gonna say thank you to Haifa and Izzy, literally everyone else who sent me well wishes, because this was something that I didn't really talk about until I was about to have the surgery. I literally didn't say anything to anyone, and I had to take a month-ish off of YouTube because of this whole thing. AJ was also very supportive, so if you're watching this, AJ, thank you so much. Everyone from Anne with the GC, everyone I've talked to, and people who have told me their stories of having similar problems or PCOS, you guys are amazing and very strong and brave. And I thank you so much for making me not feel that alone in this experience. But I am feeling a lot better now. In a way, I can't believe this is all over just because of how long I've been with this situation. But I'm glad that I can now start the new year feeling like a new me. And I'm so happy. And yeah, I hope you guys enjoyed this video. If you guys have any similar stories that you would like to share, let me know in the comments below or DM me on Instagram at Mimi with an I, because I would love to talk to you guys there. Like, if you don't want to say it in a public platform, then you can DM me on there if you would like. Thank you guys so much for always watching. I love you guys so much. I am back for the new year. I'm doing videos with my sister and I'm really excited for that. Like this video if you guys enjoyed it. Subscribe to my channel if you guys want. Follow me on all my social media accounts. They should be appearing on the screen now. I love you guys and I'll see you guys soon. Bye. Mwah. By the way, I'm not a doctor, so don't ask me for doctor advice because I'm not a doctor. I'm just telling you guys about my experience. I love you guys and I'll see you guys soon. Bye. Mwah.